Well, hello, gentlemen. Welcome to a tea break episode. I am so happy to have the two of you on board with me today.
Thank you for having us here.
Thank you, Dr. Nabal. We truly appreciate, your time with us right now, and so we can be able to share our knowledge with the community.
That's right. You are so welcome. But first of all, I want our listeners to get to know each of you a little bit better. So let's start with Manny, since you're here at the top of my screen. Okay, so Manny, please tell us, where are you from and what encouraged you to choose Loma Linda University as your school of choice?
Absolutely. Well, my family is from Mexico, Guadalajara, Jalisco, Mexico. And I was born here, but I grew up in Mexico. So it got me to understand the different cultures. Why did I choose Loma Linda? I felt like Loma Linda has all the tools for me to be successful in the nutrition field. And also it's a faith-based institution. So that caught my attention as well. And also it's a blue zone city. That's where people live longer, happier and healthier.
Wonderful. Very nice. Thank you for choosing Loma Linda University.
Thank you.
All right. Santiago, who I like to call Santi. So Santiago, where are you from?
I'm from the Boyle Heights community. I was born also in an Adventist hospital as well, which is White Memorial Hospital.
No way. Did you tell me that before?
No, I haven't told you that. No.
I was born there.
You're born there too? Oh, wow. Nice.
Hi, 10, Santi.
High five.
Yes. Okay. So, Santiago, what sparked your love for nutrition? Why did you want to get into this field?
What initially sparked my love is just just trying to treat all these diseases, like for example like diabetes, like it runs in my family, and just to be a changer, just change like the outcome of like the trajectory that they were going to go to, like I want to be able to make a difference. I want to be a positive influence for those around me, and that's what got me interested in nutrition. Yeah.
Beautiful, beautiful. Thank you for sharing that. So I am so excited because we're going to dig into the theme of our episode today, which is mental health and nutrition. So why don't we start with you, Manny, sharing your story, more of your story with us?
Thank you. Yes, I wanted to share my story just because even right now in 2021, there's still a stigma that mental health issues are not recognized as severe. Just because you don't see them with them through a medical equipment, that doesn't mean that you don't have them. I want to go back to 2 years ago, like summer 2019, where I was diagnosed with panic disorder. Believe me, for 28 years, I didn't know what anxiety was to me. And I even sometimes kind of criticize people with anxiety because I never felt that before. So how am I gonna be able to understand that if I never experienced it? So during that time, I was going through a difficult, it was very stressful from work, school, and just life was happening to me. I started feeling rapid palpitations, dizziness. I was blurry vision. I couldn't sleep. My mind was running 24/7, and I was having intrusive thoughts. Those were very frightening thoughts. I still remember I was driving down in downtown LA, and I saw someone driving a scooter, and my mind was just like, how come you don't run over this person?
Wow.
It was just, I was like, oh, this is not myself.
Yeah.
Or also, I sleep next to a balcony, and my man was like, how come you don't jump over the balcony? So this was just a terrifying time for me. I didn't know what was happening at that time. I was trying to tell my family, but they were like, "Oh, you're gonna be fine." Because in our culture, basically in the Latino culture, mental health is not seen as a disease or an ailment. It's just seen more like, "Oh, you're weak," or "You just gotta work harder." I think this kind of like type machismo, which is like, oh, men are not supposed to show any feelings or they're not supposed to cry, but we also have those feelings. So it's important to express them and talk about them. So I decided to open myself to and seek treatment with a psychiatrist. And once I started talking to him, he understood me. That's what I really like about that, because not even my mom or my family were able to understand what I was going through at that time, those feelings, those thoughts. I even was hallucinating, and sometimes some people like were like kind of like seeing me, but they were not even paying attention to what I was doing. But in my mind was like, oh, they're seeing you, they're looking at you. So I opened up to a psychiatrist, and he told me those feelings, those thoughts were normal. Yeah, supposedly the brain is working differently when you're feeling anxious. Um, yes, so that's why I wanted to break. I want to be able to break the stigma with about mental health, because it's really serious. And I was investigating, and every 11 minutes, people one people like commit suicide. So it's very alarming. So that's why
Definitely. Oh,
we have decided to talk about mental health, and it wasn't easy for me, but I want to be able to help others with if they're going through that right now.
mhm. Thank you so much for being transparent in sharing your personal story, because it will encourage others who are going through mental health and who have felt like, I'm embarrassed to admit that I have it, when nobody should. It doesn't show any signs of weakness at all. We all have something that we are dealing with, that we can overcome and continue to fight when we have the right tools. And you seeked out getting the right tools to help you.
Yeah, definitely. It's not easy, just like you said. If you're going through a mental health issue or any anxiety, depression, schizophrenia, or OCD, I think you are stronger than what you think. That's I'm really proud of anyone who's going through that, because it's not easy. It's really difficult, and uh, it's just overwhelming sometimes. But I was able to get better with. I'm not a big fan of taking medication, to be honest. I'm not a medication person,
Yeah,
but at that time I had to do it to get
right.
better.
Yeah.
And now I know how to cope with anxiety. I also included nutrition with it, and I feel better than before.
Wow, praise God. So you got off your medications.
Yes.
Oh, amazing. Because you have taken further care of yourself, and now you're a testimony of
Yeah.
can be done
Yes.
without medication.
Yes. So I'm really happy about that. It wasn't easy in the beginning. The side effects also, they were really, well, I had like dry mouth, I felt dizzy, I felt more anxious, which it was very terrifying. But I got to it, and I feel better now, and
Yes.
that's what matters. Like I just want to encourage people that there is hope, there is a light, or after uh, the dark tunnel, and then there is calm after the storm. So
Yes. Beautiful. Thank you for sharing. And
uh,
Sun,
I think you're muted, Dr. Nabal.
Sorry about that. Okay. Thank you for pointing that out. Okay. And I just want to say thank you, Santiago, for being able to also support Manny in sharing this platform with him and sharing this message, because it is very important. So thank you for supporting him and sharing this message.
Of course, not only is he my fellow student, but I also do consider him my friend also. Yeah.
I love the brotherhood that the two of you have with each other. So nice to see. All right, so let's get into more discussion about this. So who would like to tell me what is nutritional science, neuroscience? Sorry, what is nutritional neuroscience?
Yeah, definitely. So, I think few people are unaware of the connection between mental health and nutrition. Um, Therefore, nutritional neuroscience or nutritional psychiatry is a new emerging discipline that is shedding light on the fact that nutritional factors are intertwined with with the way we think, with the way we express ourselves, with the way we feel. Therefore, it is imperative that having an adequate or an optimal nutrition will help mitigate those mental health issues.
Okay, yes, excellent. Thank you. Thank you for that. So then, what are key factors that are involved in mental health?
Well, the first one is gut health. I think I learned a lot from you. Yes. Yeah, like I was talking to Santiago earlier today, our body is like a car, and the engine will be the gut and the computer will be the brain. So it depends how you feed the car, it depends on what type of oil you use for the car. That's how it's gonna perform.
Yeah.
And if there is something wrong with the car, there's an issue, the computer will detect that. It will be the same thing with the body. If there is an issue with the gut, there will be an issue with the brain as well.
Mm,
And also 90% of the serotonin is made in the gut.
yes.
So that's an important factor. The gut it's kind of like the second brain.
Right. And I'm going to add something in there. What happens when we don't get enough serotonin?
Oh, definitely. There will be you will be more there will be a higher association to develop more depression, then lack of appetite, poor mood, and lack of interest
Yeah,
in things.
so true. Those are excellent points that you just stated. And also it can affect our quality of sleep. It affects production of melatonin. So we need that serotonin to help make melatonin.
Yes, that's very, yeah, inclusively a lot of people take melatonin before they go to sleep because, oh, that's they can sleep. Sometimes I even take melatonin.
Yeah, right.
But if there is a more if you can get it from foods, that will be better.
True. And melatonin is not per se a drug. So
Yeah.
yes, when it is needed, because there are times that our bodies won't produce it because maybe we're still going through a transition of optimizing our gut health, and then it gets better, then we won't need that extra melatonin. But it's a gift.
Yes.
Yes. Okay.
I wanted to add something. Also, he was talking a little bit about gut health, but also just nutrition in general. Like deficiencies in micronutrients can lead to an imbalance in our bodies. Like our bodies are want to contain a constant homeostasis, a consistency, basically. For example, a pH of 7.4 and a temperature, optimal temperature also. So any imbalance may lead to other imbalances and may lead to ultimately mental issues, So it's all connected.
Excellent. And thank you for pointing that out too, Santiago, because like especially magnesium is one of those that is involved with depression and anxiety too. So if there's an imbalance in that particular mineral too, one out of many, then, but when that gets addressed within the gut health sphere, it will also help people feel better too and have a better outlook. So yes, thank you. Thank you
Yes.
for sharing that.
Yeah, and also another component will be cognitive behavioral therapy.
Yes.
And yeah, sometimes it might not be nutrition related. It might just be maybe past physical or psychological trauma
Correct.
from you were from childhood to it will carry to adulthood as well. So just by the fact of talking about it to maybe someone that you trust, maybe a professional, will help out a lot for the recovery process.
Oh, I agree. I am a believer in cognitive behavioral therapy too. I experienced it myself going through difficulty with life, like with my dissertation, because I felt like I couldn't move forward. I felt like I was failing in so many milestones of the doctoral program that I sought help myself with a therapist. But the cognitive behavioral therapy, changing my thoughts or helping me see things through a different lens and correcting some of my core beliefs that were off. It made me go, oh, okay, thank you. And it has helped me move forward. So yes, cognitive behavioral therapy, key.
Yeah, thank you for sharing that, Dr. Nabal. Sometimes people think that those who have higher authority, like doctors, nurses, they don't have, people think that they don't have any issues, or even like politicians. But yeah, we all are human beings and we all go through something in life. So thank
Yes.
you for sharing that with us.
Oh, yes, you're welcome. And yeah, I just want to encourage people to, yes, seek out help. There are therapists that are trained to help us because none of us have it always perfectly together because we're all human, as you said. And it doesn't matter how many degrees you have or what position you hold, we all have something that we can improve on in our lives. And I know my cognitive thoughts needed some help. So yeah, but thank God for those who go into this training to help us so that we can move forward in life. Okay.
Also, I apologize. Can I also add a
Go
couple more
on,
factors
Santi.
that may help? Okay, so as you all know, Manny himself, he loves to exercise, and exercise is very, very important. Uh, it can help out with like symptoms of anxiety, depression, panic disorder, and just like it has been shown that just like exercising 20 to 40 minutes can help improve your anxiety and mood for several hours. The only thing you have to be careful is like just don't overdo it because that can also like bring like a decline to your physical health if you overdo it. Everything in moderation is always very important. And I also want to bring up another factor that could help out with mental health, which is just getting a proper sleep, especially for students. Like, right, like many times we don't sleep right. Therefore, we could suffer more from anxiety, just stress out about a test. It gets to us more when we're tired.
Mhm.
Just getting an adequate sleep is very important for mental health as well.
Oh, Guy, that's a huge one, sleep. So thank you for pointing that out. All right. So then what are key nutrients that can help optimizing mental health and why?
Absolutely. So I want to start with two macronutrients that are important for mental health. The
Okay.
first one will be protein, and you're gonna ask us why protein. So the neurotransmitters like serotonin and dopamine are made of amino acids. For example, tryptophan is a precursor for serotonin,
Yes.
and the function of serotonin is to induce quality of sleep and tranquility. And also, it will improve your mood. let's say sometimes you feel depressed, so having adequate levels of serotonin will help you feel happier. And then tyrosine is a precursor for dopamine. So those two amino acids are key important amino acids to produce those neurotransmitters. And if there is a lack of these two amino acids, there will be not enough synthesis, which is associated with, in one of the studies, is associated with aggression in patients and low mood. Their mood will be unhappy or unsatisfied. And also the other macronutrients will be carbohydrates. And you're gonna ask, why carbohydrates? So whenever you consume a carbohydrate-rich meal, it will trigger the production of insulin. And insulin will help blood sugar get into the cells to produce energy. And simultaneously, it will trigger the entry of tryptophan into the brain. And as we know, tryptophan produces serotonin. And when I was reading, I was talking to Santiago earlier this morning that the consumption of diet low in carbohydrates will precipitate depression symptoms. Seems like the production of brain chemicals like serotonin and tryptophan, they promote the well-being of how we feel. So everything was triggered by carbohydrate-rich foods. So definitely, and when we talk about carbohydrates, we're not talking about refined carbohydrates. We're talking about unprocessed like legumes, nuts, seeds, fruits and vegetables, whole grains, those that are in like low glycemic index carbohydrates.
Yes. Wow. That is so key right there. Those two
Yes.
macronutrients.
Protein and carbohydrates.
Mm-hmm.
If you may also add, some other nutrients that are important are, for example, omega-3 fatty acids. If
Oh,
you think
yes.
back 50 years ago, 100 years ago, our ancestors did not eat as much processed food as we eat now. They ate more healthier, they ate more natural food, and
Correct.
like ate way more. The standard American diet eats way more of another omega-6 fatty acid, which is about 20 times more, or 20 to 25 times more than omega-3 fatty acids, which is something that we need. And a deficiency in omega-3 fatty acids, as well as the consumption of a Western diet, which is like processed food, is associated with cognitive impairment. So, like, it's very important to just try to step away from trying to eat too many processed foods, try to eat more omega-3 fatty acids, found in salmon, found in nuts, found in avocados, for example. And it has also been shown that there is an inverse association between omega-3 fatty acid consumption and depression, meaning if you eat more omega-3 fatty acids, you're less likely to suffer from depression. And with that nutrient, there's also another nutrient that's very important to consider, which is vitamin B12. And it's like, for example, for older people, especially because they need more, like it could lead to Alzheimer's disease if they have the deficiency, you know? It could lead to memory loss, it could lead to dementia. And so that's why it's always important, especially for those, because vitamin B12 is found in, for the most part, animal products, like milk and meat, right? So it's especially important for vegetarians to get an adequate amount of both omega-3 fatty acids and vitamin B12. Yeah, a supplementation would be advised.
Yes.
And also, Santiago was talking about vitamin B12. There's also another B vitamins like vitamin B1, B2, and B6, which is riboflavin, thiamine, riboflavin, and pyridoxine, and also folate. Those are key essential nutrients for mental health. In one of the studies I was reading earlier, it says that those who are deficient in these nutrients are more likely to be depressed or anxious. So where can you find these nutrients? Basically legumes, leafy greens like kale, spinach, fortified foods, and also nutritional yeast. And nutritional yeast is actually mostly used by vegan or vegetarians that they want to add more B vitamins like vitamin B12. Santiago was talking about it. And those are essential vitamins. And it's an important, I usually add it on my scrambled eggs. I add some nutritional yeast, add more quality, and it also has protein. So that's a plus. And another mineral, now we're going to talk about a few minerals, which is zinc. Zinc, those who are deficient in zinc are more likely to be depressed. And zinc, supplementing yourself with zinc will help you mitigate depression symptoms and also protect the brain against the potential of free radicals caused by stress or other environmental factors. There's another one, and I think you mentioned that one before, magnesium. And I believe there's like 10 types of magnesium out there, but the ones that were studied in this clinical trial were magnesium glycinate or taurate. And they treated patients with, I believe it was 125 milligrams to 300 milligrams of magnesium. They provided this dose before each meal and before bedtime. And within less than 7 days, their major depression symptoms lessen, and they have a faster recovery.
Wow.
Meaning that magnesium is a key nutrient for mental health.
Mm-hmm.
I usually take magnesium before to sleep, and I honestly sleep well.
Yes, I know. I'm a magnesium glycinate gal. So
yes,
I know how helpful it is.
And where can you find magnesium in foods? That could be like pumpkin seeds, almonds, legumes, yogurt, spinach, and also fortified breakfast cereals. Yeah.
True. And we definitely can get it there too. Unfortunately, our farming processes over the past decades has affected our soil, so it affects the production of food, and we're just not getting as much magnesium from our foods. That's why it is a good thing to do a combination of foods and supplementation.
Yeah, definitely. Unfortunately, now with this process of making a higher demand of products, it's hurting our soil and our planet as well. So I think we gotta be cautious about that. And that's why it's imperative to buy locally from your farmers. And I mean, where the food is coming from, and it will be cheaper and it will be higher in nutrients.
Indeed. Wow.
Yeah, there's also one more mineral that I wanted to talk about.
Yes, please.
And that is calcium. And why calcium? And I was talking to Santiago 2 days ago about calcium. And since I was taking a selective serotonin uptake inhibitor, which is an antidepressant medication also that treats anxiety, I actually found it really interesting that this antidepressant medication inhibits the absorption of calcium into the bones. So the study wasn't really conclusive on like how long do you have to wait before you take like maybe a calcium-rich food. But I usually wait 2 hours. Let's say I take my I take my medication like in the morning. I'm putting just an example. Then I wait like 2 hours so it can like be properly digested and then distributed to my body. And then I take maybe some milk or a milk alternative or any leafy greens. So definitely supplementing yourself with calcium or eating calcium-rich foods will be ideal if you are taking an antidepressant medication.
Yeah, that is an important fact to really bring to the table, because we don't always pay attention to these medications that we take. And I know that they have a place. God did create them to help us, but some of these medications do have that food and drug type of interaction where it can affect our nutrients. So that is so important. So I'm glad you brought that to the table here. Yes.
If I may also share a couple more nutrients
Yes.
Well, this is probably something that a lot of people from your podcast have already maybe heard of, probiotics, right?
Yeah, bring it on, bring it on. It's all good.
So probiotics, for example, like bacteria like lactobacillus and bifidobacteria, they're very important because they, as I'm going to talk about it in a sec, but they help produce like neurotransmitters as well, and they help also hormones as well, and like keeping the right community in there. And the way you do this is by eating like a good amount of fiber, because bacteria, the good bacteria, they love fiber. And another way of saying this is also prebiotics, which prebiotics are basically soluble fiber, can be found in soluble fiber for the most part, which are fermentable by bacteria. So, like good sources of this soluble fiber would be, for example, like legumes, like beans, like kidney beans, avocados, sweet potatoes, for example. And the way they connect, I guess, with the brain, the probiotics and the prebiotics, is a term called psychobiotics.
Ah, yes.
So you actually suggested that I read a book, Psychobiotics, which is very interesting. And basically, psychobiotics are beneficial bacteria, which is the probiotics, for support of the of such bacteria, which is the probiotics that influence the brain relationship. They have an influence in the brain, you know. So very important because, like I was saying, psychobiotics produce neurotransmitters, which is amazing because like these bacteria could find a way to communicate with our brain. They produce dopamine, they produce serotonin, to name a few. And dopamine helps out with our kidney function, our heart rate, and our sleep. And as we were talking about before, serotonin is also very important for people that are suffering from depression, you know?
Right.
So everything is connected. And
It is. Oh,
also, one more thing.
yes.
So we talked about like all the nutrients you should try to eat more of, but a nutrient, something you should try to avoid a little bit of, and a lot of college students, a lot of people are guilty of this, is caffeine.
Bring it on, brother. Bring it on. Preach it right here. Just say it as it is. Let's just hear it. No sugar.
No sugarcoating. So in college students, it has an association with anxiety and depression, and it has not shown to help out in your test scores. So many people may think, oh, I'm this coffee is going to help me out, right? But it has had no association to help you out in your test scores. And the way it does this is like physiologically, you feel tired. You have a buildup of something called adenosine, and there are receptors, and the adenosine tries to go in the receptor, but the caffeine gets in the way. So therefore, you physiologically, even though physiologically you're tired, you don't feel tired. So that's why it's not good for you. Yeah.
There you go. You know, when I was in college, my first year in college, when I was a freshman, I remember going to class, to my English class, and it was in the afternoon. And our class was in a trailer at La Sierra University. So I was on my way there, and my other classmates were walking down towards the trailer. And these two guys, they were like buddies, just like Manny and Santi, the two of you. You always see, so these two guys together, like I always see you two guys together. And I remember they had like coffee in one hand, and I was like, because I was very like, I didn't know a lot back then. So I said, oh, that looks like a good drink. What's that? And both of them, they're like, Gigi, you don't want to start this. I'm like, what? What do you mean? And they're like, it's coffee. And but our best advice to give, but I wasn't even asking for advice. I was just like, hey, what are you drinking? And they're like, just trust us. You don't want to start this. And I took them seriously. And so I was like, okay. But on the other hand, I'm a slow metabolizer of caffeine. So I don't feel good when I do regular caffeine, but I know it's a double-edged sword. You know, there are people who are fast metabolizers of caffeine, so they can have up to, they say up to 400 milligrams a day. But those who are who are slow metabolizers, they can have only about up to 250 milligrams of caffeine per day. But then I always say, but even if you're a slow metabolizer, if it bothers you more than just, even if you have the 250, you got to listen to your body and adjust. And some of these general recommendations, you got to lay it aside and see what works for your body and what doesn't. So, yeah, but I'm glad you brought this up.
I agree with you. You know what Santiago said and what you said, Dr. Nabal. Um, before I got, diagnosed, before I went through this unfortunate situation like 2 years ago, I was drinking a lot of caffeine, or even the pre-workout does that. It has a lot of like caffeine. One scoop has like 350 milligrams of caffeine. Plus, I was having like 2 cups of coffee just to maintain the physical demands from school, from work, and from my exercise. So, through time, I think it was like a time of like 5 years of having the same consistent routine of having my pre-workout, my coffee. It just got to a point where my body couldn't, it kind of, I don't know if it changed the brain chemistry. I have no clue, but it definitely made me feel different, more anxious. And even sometimes, even nowadays, I feel anxious, but I know how to cope with it through like meditation, prayer,
Right.
or breath work. That it also has helped me a lot.
Excellent, excellent. Thank you. Thank you for sharing your personal experience with that. But it is important, yeah, to be mindful of the caffeine, because it can really affect not only that, we all have a mental side that we all have to take care of, but then there's also the hormonal side too. So lots of edges to this sword for
Yes.
caffeine. Now we could go into another hour.
Yeah.
As we like to talk about nutrition and all the different aspects of it. So, but gentlemen, thank you so much for all that you have shared and all the wisdom and knowledge that you both have gleaned. And for sharing.
Thank you. And yeah, we just want to reiterate that to optimize your mental health, it's important to have an optimized gut health.
Correct.
It's priority, because if the gut health is not okay, that means that your brain will be healthy as well.
Yeah.
And also the nutrients to incorporate will be adequate protein intake, carbohydrates, whole grains, fruits and vegetables, nuts, seeds, and legumes. Less on processed foods, also calcium, magnesium, zinc,
Yes.
vitamin B12, omega-3, and just like Santiago said, prebiotics, probiotics, those are essential for our gut health and for our brain as well.
Thank you for summarizing all that for us. I greatly appreciate it. Thank you, gentlemen, for taking your time to be here with me today. I know that you guys are busy with school and everything else that this quarter entails, but I want to say, may God bless you on the rest of your academic journey. You're both graduating in less than a year, so I know these are exciting times, and I wish the best for both of you. Thank you again for being here today.
Thank you for providing us the opportunity to share our knowledge with other people and my experience, which hopefully people can relate to that and be able to seek treatment and be able to open up to their psychiatrist or maybe someone who they can trust. And yes, we have to break the stigma of mental health.
Absolutely.
Thank you for inviting.
Okay, thank you. All right, gentlemen, take care.